Vaccine preventable but highly transmissible viral infection that affects mostly children under 5 years. Measles affects up to 20 million people a year worldwide, with most of these infections seen in the developing areas of Africa and Asia. Now, with Nigeria among the 45 countries that account for 94% of the deaths due to measles worldwide, the federal government has now begun implementing measles second dose vaccination at 15 months as part of the routine immunization schedule across the 19 northern states and the FCT. Now, already introduced in the 17 southern states since November 2019, this exercise in the northern states will run from Monday 7th December through Friday 11th December 2020. And apart from the usual first dose of measles at 9 months old, all eligible children at 15 months old are required to take the second dose of measles vaccine. So, how can eligible children access the vaccine and within what time frame daily? These are some of the questions begging for answers on Nigeria Today. Welcome to the program. I am Victor Azu. In the studio to discuss the second dose measles vaccination is Dr. Basi Oposen, Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Dr. Oposen, welcome to Nigeria Today.
Thank you. Good evening, Nigerians.
Now, let's cut to the chase. Give us a sense of statistics that make measles a dreaded disease in Nigeria, and how contagious is it?
Okay. Measles is a serious, highly contagious viral disease. Globally, and from available evidence, once exposed, 90% of people could stand a risk of contracting the disease. Now, before 1963, when the measles vaccine was introduced, about 615,600 from available records from WHO, children and vulnerable adults were dying every year. Now, there are also records that every year, 2 to 3 years, there were epidemics, and we were losing that much every year. Same source from WHO by 2018 showed that with the efforts that are ongoing by various governments of the world, including the federal government of Nigeria, these deaths have reduced from then 615,600 to about 134,000 children annually from all the globe. And when you want to, you ask Nigeria specific, in Nigeria specific data, you can see, let me compare 2019 and 2020 from NCDC surveillance data. In 2019, as at same time last year, 2019, from NCDC database, we had about 58,113 cases, reported cases of measles in Nigeria. Same time this year, this December, first week December, we've recorded 24,903 children. You could see about 57% reduction in 1 year alone. This, we can only say a very big thank you to Mr. President, President Buhari, the Minister of Health, Dr. Hanire, the Executive Director of National Primary Care Development Agency, Dr. Faisal Shweb, all the management staff, and then partners for the support they are giving to ensure that measles does not kill our children and vulnerable adults.
So, at what age should a child get the MMR vaccine, and how effective is it? Because from the statistics you have given, it sounds more like a miracle worker.
Yeah, measles vaccine, I will say boldly, proudly, and on behalf of the team, that is very, very safe, is very, very effective, and it is not costly because it is given to Nigerians, that the children that are eligible for the vaccination is given free of charge. And you realize that these vaccines are available there, and the government of Nigeria, under this president, buys 100% of the vaccines that are given to our children free. Any child that is linking to the question you just asked now, at what age should that child be immunized? At 9 months, we encourage all Nigerian parents, caregivers who have children 9 months old, to take their children to the health facilities near them, whether federal or public. And interestingly, even the private facilities get these vaccines free from the federal government of Nigeria. So at 9 months, the child is eligible to receive the first dose. Now, like you introduced earlier, if 100 children receive first dose of measles vaccine, 85 of them will develop immunity. The other 15 will not develop. When you now give a second dose to those children, it increases to 95 of the 100. So what the government of Nigeria is doing now is giving more of our children opportunity not to suffer any morbidity or mortality from measles any longer, by ensuring that more children are being protected against the measles disease.
In other words, you could stop at the first dose and still have up to 70-something% covered.
85%
covered.
But we don't want any child to come down with it, because the vaccine is available.
To perhaps
yes, to ensure that,
99.9.
yes, and that's why we give that second. And for the second dose, which is to be given at 15 months, it has come to stay. Like we introduced earlier, it was introduced into the routine immunization schedule in the southern state in November 2019, and we could see the usual outbreaks that comes at the beginning of the year were not recorded in the south. The second dose is now being introduced in the 19 northern states and the Federal Capital Territory. The introduction started yesterday. So we will have this 1 week of intensification from the 7th, that was yesterday, through Friday, to create more awareness for Nigerians to go and take their wards that are 15 months old for a second dose. And after this 1 week, the vaccine has come to stay. It will be available at both our public and private health facilities in the country for our children to receive as a routine vaccine, second dose.
Now, I'm curious, if a child is treated of measles, does that child develop immunity, or does he or she still require to be vaccinated?
If a child is immunized, it develops a lifelong immunity.
And treatment confers immunity?
Or infection.
Or immunization?
The infection, because with the measles itself does not have an anti-viral drug that will stop it. It's a viral disease. So you only treat the symptoms consecutively, you give supportive treatment. But if a child comes down with it, it develops immunity that can take that child through in life. But the thing we advise our Nigerian parents and caregivers, let's not wait until that child goes through that stress, because measles on its own, if a child comes down with it and was not vaccinated, can develop complications. Okay. And there are several complications that can come with it, serious ones. For instance, blindness can be a complication. Infection of the ears, which can later lead to deafness, can develop. You can also have pneumonia, can come with it as a complication. And any of these ones, even encephalitis, meningitis, can come with it. The brain will become swollen because of the infection, and before you know it, the child is off. It could be serious diarrhea that can come along with it, and that diarrhea from dehydration, the child can die. So, and there are so many other complications that comes with measles disease. So we don't advise parents to leave their children to go through that stress of developing measles disease to get the natural immunity. Not all of them are lucky to survive the complications.
But are there side effects? Are there side effects for those who take, the vaccination?
The side effects of measles vaccine, if I might say so, are very transient effects that cannot be compared to the complications that come with it. For instance, it's an injection. You give the child at the initial time, the child will shout, cry, and so on, which is natural. And then some of them might have mild fever after the vaccination, and a few of them can have swelling around that area. So in such instances, the health workers are trained. They give that child ordinary children paracetamol or any other analgesic to take care of the fever, but that is just it. And there are few of them, if there was, for instance, the needle would have been contaminated in one way, maybe you can have an abscess around the area which is treated locally. So, but generally, any side effect that will come will be usually those of mild ones that are managed even by the health workers. And also to reassure Nigerians that during the campaigns, we, working with the state, keep safety AFI kits in all the health facility, where once in 1.5 million children might have convulsion after receiving it. In such instances, from the AFI kit that is available at the health facility, they are resuscitated and the child is back to normal. But we don't notice any serious complications, but we just see those fever and so on. And in the course of the campaign, we have this paracetamol and the rest being provided at the health facilities to support parents so that they can give to their children.
So how should parents react if they notice certain side effects as a result of the immunization?
Well, I will put it that if they notice those mild fever, so that they will not be scared about it, they give the normal paracetamol that they have at home, and if after a day it does not respond, they should go back to the health facility nearest to them to report to the health workers, who will follow usual protocols of treatment to attend to that child.
All right, Dr. Posen, we still have quite a lot to talk about, but we'll go on a short break, and the program will be back, I promise. Welcome back, and if you've just tuned in, the program is Nigeria Today, and we have been discussing the second dose measles vaccination with Dr. Basi Okposen. He's Director, Disease Control and Immunization, National Primary Healthcare Development Agency. Now, Dr. Okposen, how might eligible children access the vaccine as it is ongoing now?
As it's ongoing now, we have these strategies to deliver this vaccine. Before this week of intensification, last week, we engaged the traditional leaders, the religious leaders,
community leaders,
the community leaders, the opinion leaders, the media, to sensitize our Nigerians to know that these vaccines will be available. Now, for this week of intensification, we have three main strategies. The first is the fixed post strategy. In other words, all our primary, secondary, and tertiary institutions, whether public or private, are to open for the measles second dose and other antigens to be administered to the children. The second strategy is the temporary fixed post, where before now, all the teams at the LG and the state had identified certain areas with large population that don't have a hospital, whether primary health care or secondary and so on. And they have identified the number of days that these teams will work in those areas to cover the children in those areas. And then the third strategy is that of the mobile teams that goes to difficult areas that are hard to reach as a mobile team. And they also have mapped out the areas that these teams will reach during this period. And during this period of the 5 days of intensification, 7th to 11th of this December, all the health facilities, public, private, primary, secondary, tertiary, will be open to ensure that all our eligible children from 9 months old are given for those who have never received, and those that are 15 months old will be given this measles second dose free of charge. If there's a child that is above 15 months, less than 2 years, please, the parents should take the child to the clinic. We are targeting children for the second dose for this inception from 15 months to 23 months. But any child that is below 2 years should be taken for the second dose. And thereafter, we are encouraging at 15 months, parents should routinely take their children for the second dose because it is at that time it is due. So the vaccine is available in our health facilities. It is free of charge. Please, it is free of charge. And I said earlier, the vaccines are safe, effective, and not to be paid for.
Now, the exercise is for 5 days. 2 days already gone. Within what time of the day can the children get access to this vaccination? Is it round the clock?
Okay, there are two things here. The first I will mention to Nigerians is the fact that even after this 1 week of intensification, the measles second dose has come to stay in our country routine immunization schedule. Even after Friday, from Monday, in any facility, public, private, in the 19 northern states and the Federal Capital Territory, the vaccination will still continue. Like we did introduce in the southern states, 17 southern states, from the introduction date on the 9th of November 2019 till date, any child that goes at 15 months is given the second dose free of charge. Now, regarding the question you asked, at what time of the day, the teams leave very early, depending on their strategy. There are some that have to go to the communities they have planned with to reach them before they leave for the farm, because they must seek consent from the parents. And then there are some that will start like the fixed facilities. Of course, they will start with their normal work in the morning by 8 o'clock that is required of them. But they will do this until 4 o'clock, because by that 4 o'clock or 5 o'clock, depending on the location, the team members must go for the evening review meeting. On a daily basis, they meet, review what happened that day, receive reports from the various locations the vaccination took place, compile, collect the results, and on a daily basis, use the reporting tool that is available to give information on what has happened that day. And they also use that opportunity to plan for the next day so that they know exactly what to do on the following day. So during those working hours and the time that the public has been notified, all caregivers, the parents, can take their children to the facilities, the identified fixed posts, and then those mobile teams to get this vaccination free of charge.
So why do some parents still resist? And is there any health reason for which a child might not take the vaccination?
You know, why some parents will resist, you know, it's not as bad as what it used to be. I know in the time past, there used to be a lot of rejection. There's been a lot of ongoing activities that most parents are being convinced to know that measles vaccination is good. In fact, you actually see most of them trooping out, bringing their children to do it. So the rejection is not as much as what it used to be. But having said that, there are still some situations where, based on especially cultural reasons, based on religious reasons, some will say in our culture we don't take injection, in our culture we don't listen to radio, in our culture we don't do this. I've actually seen a community like that where in the history of the community they've never been immunized. When I went there, and I won't mention the state and the particular location, the traditional leader of the place was bold enough to say, we don't listen to radio, we don't take anything, injection, drop. If our children do that, they will die. But what I had to do, because we were concerned about those children, there were so many eligible children, I now told the village head, I said, these children are our children, and I can assure you that they won't die when they take the vaccination. I will stay behind with you and ensure that these children after vaccination are safe before I go. He now said, okay, let's enter into a deal. We will immunize the children. You will sleep in this village tonight. Is anything happen to any of the children, we will kill you. And I said, I'm ready to do that because I know that the measles vaccine is very safe.
Interesting.
Do you know it was that decision that made the man to now call the elders and told the elders what I said, that I'm ready to sleep in the village. If anything happened to any of the child, I should be killed. That was how the whole community accepted the vaccination. So you can see that was belief. There are some who say, oh, in our Christian faith, in our Muslim faith, we are not supposed to take medicine. So the only thing we do in such instance is to speak to them, tell them the importance of the vaccine. Like I mentioned earlier at the beginning of the vaccination, look at the number of lives we used to lose every year. But now it is very clear we are not seeing it. We have actually had instances from some universities that say they didn't see measles cases to teach their children. All this can only be possible because of vaccination. So I wouldn't expect our Nigerians to keep on saying they won't take measles vaccine. You know, they did same to also yellow fever. You could see once we had the yellow fever outbreak in Delta, Enugu, and Bauchi, and the vaccination was given, it's silence. Before, we were having a lot of deaths from meningitis. Indeed. With the vaccination, we have seen a drastic reduction. So please, I appeal to Nigerians. The president is committed, the minister is committed, the executive director, Dr. Faisal, all our partners, to ensure that our children are protected from these vaccine preventable diseases.
But is it this reason or reasons like this that you broke the immunization into southern Nigeria last year and then northern Nigeria this year? Could that be the reason? Was it not possible to have taken on the entire country at about the same time?
Okay, this is what happened. We were approaching the peak season for the measles. And the nation is big. We need all the personnel to support the routine introduction. So what we did was, in the northern state, there were campaigns, the measles campaign, for the children to be immunized. So all the children that were eligible were immunized at once. But it was not a roll out into the routine system because that takes a process of training for them to understand the system for the routine immunization. So there were northern states, there were campaigns in all the 19 northern states and the FCT. While in the southern state, we now did the training using the personnel and all the people that we have around to ensure that we did all the demonstration and then we now introduced into the routine immunization system. Even in the northern states, we could see that this year the outbreaks were just narrowed down to 3 states. State of Borno, Sokoto, and then a few cases from Osun State. So we could see that the intervention in the south for the routine introduction was successful. The campaign was successful, but now we are scaling up to the entire nation so that we know that at any point, any Nigerian parents, caregiver take their children to the clinic at 9 months, they can get the first dose. Okay. At 15 months, they go for the second dose. And this will remain in the system sustained.
Dr. Bosa, my director just whispered to me that I have about 90 seconds to go, but I won't let you go without asking this question. I am told that those born before 1957 are considered immune to measles. How and why is this so?
Then there were so many cases, like I mentioned earlier, of measles in the world. There was no vaccine. About 615,000 persons were dying globally. So they were getting infected, and some of them that were infected developed the natural immunity. Okay. It's those that had the natural immunity from the disease that survived. But now we don't want the children to pass through the stress of developing the disease to have immunity. From birth, they should be given the vaccine to develop the immunity and not experience what our great-grandparents experienced.
All right, it's been an illuminating discussion. But every good thing does have an end, isn't it? Dr. Bassio Pose, Director, Disease Control and Immunization, National Primary Healthcare Development Agency, thank you for your insights on Nigeria Today.
Thank you so much. Please, Nigerians, take your children for measles second dose and other vaccines.
All right, Nigeria Today is live every weekday on NTA News 24 at 7:30 in the evening. But you can watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azu. Thanks for your company. I'll see you next time.